Hi, I am Dr. Pankaj Yadav. I am consultant pediatrics and neonatology at Cloud9 Golf Course Road, Gurgaon. Why the symptoms are more in the night? It is still under research and not very conclusive. So we don't know why it is more in the evening, but there are few attributes that we have come across and which are known. So generally what happens that during the evening there is a drop in temperature which causes vasoconstriction, vasospasm. So generally the symptoms are more. Also when you are lying down, your lung capacity reduces, so the diaphragm comes up, which also pushes the lungs up. So that also reduces the breathing space. Also it is seen that there is some reflux, which is gastroesophageal reflux, which is also attributing to the more symptoms during the night. Sometimes it can be obesity. When you are in deep sleep, there can be some obstructive sleep apnea, which are also contributing to the increase in night symptoms. And also you can see that sometimes hormonal changes also there. So like histamine is released more in the evening, which is again responsible for increasing the secretions and causing more of the symptoms. So what you can do when you feel these symptoms are there? So it is very important that you are having a sound sleep where the environment and temperature is maintained. You should also make sure that it should be a dust-free environment where there are no allergens. So always keep your room free from the things which can attract dust, like soft toys are there, or there are some like mats are there. So these things should be avoided. And also you should take care about the what all you are having just before the sleep. So avoid taking any allergen, which like any food substance which causes more increase in symptoms. So you'll have to identify the allergens and you have to avoid them. And for acute relief, again it is required. If required, you may need to take a bronchodilator. If it is already on some medication, you have to take it. And also we generally prescribe one preventive medicine which is taken before the bedtime. That also helps to relieve these symptoms. So you just have to take care of the allergens and sudden change of temperature. These things should be taken care. And if there is a severe episode, if you are having severe breathlessness, just need to take a bronchodilator, which can be in form of nebulizer or it can be in form of a puff.